Hi, I'm Dr. Mandar Agashe. I'll be talking on a very important topic, which is hip dysplasia or hip dislocation in a very young child. How do we treat hip dysplasia if it is not diagnosed at an early age? There are various methods. If it's an early infant, if it's between 6 months to 1 year or 6 months to about 15 months, an attempt can be made to treat hip dysplasia by something called as a hip spica. What does that do? It is somewhat similar to a Pavlik harness where we position the hip in such a manner that the hip remains stable in that position. However, has to be done under anesthesia. We have to see the hip going in with the help of our instant x-rays, and a rigid plaster is given for about 3 months. This is the second least morbid procedure or invasive procedure for the treatment of hip dysplasia. Most of the times we get cases where the child is not treated very early. We get kids who are of walking age, about 2-3 years of age, at which stage we have to do a major surgery in the form of open reduction and a osteotomy or a cutting of the bone of the thigh so as to position the hip in such a manner that it will remain inside the hip. This is a much bigger and much invasive procedure. However, even after that, even at a very high age, excellent results can be obtained if treated in good hands. For more information, you can visit my YouTube channel as well as my Instagram page. Thank you.